Anne-Marie, let's start with the good news. It appears that at least the war's not won, but the battles are being won against COVID.
Absolutely. We're seeing across the state our case rates are going down. You know, more people are vaccinating. Those who are getting sick tend to not have the severe symptoms. So it's a good thing. You know, as far as public health goes, we're like, yes, and we want to see this trend continue.
Huge milestone earlier this week, 0 deaths in Massachusetts. I can't remember the last time that has happened.
That's huge. It has been pre-COVID, really. I think, you know, we've had some ups and downs, but we haven't seen that. So yeah, there's a lot of celebrating going on. We're really hoping, you know, that we keep up this trend, that people do what they can to continue to protect themselves, you know, especially as things are opening up.
One of the things I've heard from people who don't necessarily believe in the science is that the protocols have changed constantly. Now the CDC has said, you know, if you're outside and you spread apart, you don't need the mask, which people were saying, well, why wasn't it like that 6 months ago? And I'm saying because they really didn't know 6 months ago.
Right, and not only that, but there were so many more people that were infectious, so your chance of coming in contact with someone was greater. So as we're getting more people, we're not, I don't know if we'll ever get to that herd immunity that we'd like, but you have a greater number, so the chance of anything, any exposure just has diminished so much. So now they feel very comfortable saying, you know what, this is good. We're doing that 6 feet, you're outside, because you still pass by people. You know, that's what happens. If you're all by yourself, no issues, but you're going to be around people, so that's why it's good to be cautious.
I don't know if you've been following what's happening with the New York Yankees. Some of the coaches who are immunized have contracted coronavirus. Now, the symptoms aren't as severe as if they had not been immunized, but it's one of the reasons why, and I heard Dr. Fauci appearing before Congress get beat up over the fact that if we're all immunized, why do we need masks? Well, you can give it to someone who's not immunized, right?
Correct. And it's also the case, it's not 100%. It's like the flu vaccine. What we're trying to do is to prevent those severe symptoms that bring people into the hospital or might cause death, you know, to someone who's especially vulnerable. You know, it is unfortunate. We would have loved to have seen that once you got the vaccine, there's no way. I have seen people who have been fully vaccinated that have gotten it, but their symptoms are mild. So that's a good thing. And that also means they're probably not as likely to spread it as severely. So, you know, we still need to vaccinate, but yeah, it's not 100%. So we still need to maintain those precautions where we're in close contact with people. You know, be mindful, especially if you don't know who the people are. They may not be vaccinated. You don't know where they've been. The most challenging thing right now is because of the mild symptoms, it's identifying who is positive. You know, we're seeing so many people who are thinking that they have allergies. You know, it's springtime and things are blooming, and so people are getting stuffy. I can't tell you how many people, that's what the symptoms are. They've got stuffiness. Maybe their eyes are just a little dry or just a little soreness in the throat, and they get tested and they're positive. So it's important for people to think of that. You might just think you have a summer cold or something like that, but consider testing just in case, just so you don't spread it to other people.
Let's bring it down to the local level. Here in North Attleboro, what do the numbers look like? North Attleboro mirroring the rest of the state in gradually going down?
Oh yes, absolutely. I can't tell you how wonderful it is to only have 2 or 3 cases instead of having 20 and 30 cases, you know, each day. So yes, we're absolutely seeing that. As of yesterday, when I was tracking, we were at about 18 cases for the week. The previous week, we had 48 cases for the week. So that's almost half. Now, today we did get some reports. We do have some more cases, so I don't think we're going to be half of that. But much better. I'm going for the green, you know, hoping that we're going to be green. The positivity rates have been dropping. We're not as low as the state. The state case positivity rate, I think, is like 1.03. We're at 2.96, but we've been dropping every week. So I'm holding out for that green.
Well, what does it say about Massachusetts in that we lead the nation in the number of people getting the vaccine? Why is that?
Well, I think because we've been going about it the right way. We've been trying to get it out there to people, particularly those the most vulnerable. You know, we follow the recommendations. I think we have a lot of people who are in the medical field. You know, Massachusetts really has a lot of medical and industrial, and so I think they're more supportive of that, while in some of the other states that are more rural, they're separated. They're not getting as many. And we have a lot of population too.
I like to think it's because we're more intelligent
Yes,
than the rest of the
yes,
nation.
yes.
That could
I like
be
that. I
could
like
be true
that.
as well.
Of course.
Final question. It was a very mild flu season, not because the flu wasn't out there. It's because it wasn't being transmitted because people were wearing their mask. Can you see to some degree going out this coming winter and seeing some people walk into restaurants with masks on?
I think so. I think we're going to find people that are going to be more mindful of that potential. And so if they're going to be out in crowded situations, they might not feel as comfortable, because I think we're going to see COVID for a while. I don't know what the longevity of it is. It going to be like flu and it's going to stay around every single year? Is it going to be for a couple of years and then it dies out? You know, the SARS-1, right? We had it for a very short period of time. So I'm hoping that maybe we'll need a booster this year, maybe next year, and then maybe perhaps at that point there'll be so many people that are protected that it won't have the vectors to spread. So holding out for that. But in the meantime, every time people wear their masks, wash their hands, social distance, it's going to reduce the flu, it's going to reduce the COVID. So it's good habits to have, and I hope we keep some of those.
I started out by asking about the battles being won. When the war is won, has Michael Borg, the town manager, asked what island that you would like to vacation at and give you 3 months off?
Yes, I'm planning to go to Guam, I hope. I have my daughter's in the Navy, so she and her family are there. That was something that was last May we had hoped to do. So we're planning for December to be able to take a trip to Guam. I'll still wear my mask, that's for sure, and hand wash and social distance, but yeah, it will be nice for people to be able to do things like that.